We've seen this happen over and over. Politicians, with the best of intentions, enact reforms, hoping to help the people they represent. But they actually just make things worse. I've seen this over and over in my work as an actuary. Kentucky tried healthcare reform in the mid-1990s. A lot of their ideas were very similar to what is in Congress right now. It didn't work. They adopted guarantee issue so that nobody could be denied coverage. They adopted modified community rating so that everybody the same age was charged the same rate regardless of health. Sound familiar? Guess what happened? Rates spiraled out of control. 40 insurance companies left the individual market until only one remained. That company worked with representatives in the state to get rates back under control. Kentucky learned from their mistakes and quickly turned things around. They allowed insurers to start underwriting. They allowed insurers to charge healthy members less expensive rates so that they would start getting coverage and their premiums could subsidize the rates of the less healthy. But they didn't leave the sick out in the cold. Instead, they created a high-risk pool. A high-risk pool is an insurance offered by the state. It's often subsidized by reasonable taxes on health insurance, and it's a last resort for those who can't qualify for rates through traditional insurance. The rates are higher, but they are still subsidized, which means these members aren't expected to pay 100% of their own cost. Today, Kentucky is a success story. Kentuckians enjoy some of the most affordable rates in the nation. And it's not like Kentucky has a reputation for great health. They're in the bottom 10 for smoking and obesity, but they're still able to maintain rates lower than much of the rest of the country. Now contrast all this with the experience in New York. New York is the 12th best state for smoking and the 13th best for obesity. So they're pretty much at the other end of the spectrum from Kentucky in terms of the population's health. And yet, rates there for healthy young people are ridiculously high in the individual market. To make rates somewhat reasonable, New York insurers sell a lot of coverage for hospital only. That means these members have no coverage whatsoever for doctor's visits. For most health plans, doctor's office visits and other professional charges account for about a third of your total cost. In fact, these hospital-only plans are so stripped down that they wouldn't even exist if the current legislation passes. According to a study by WellPoint, members in some of these plans in New York today would see their rates go up 60% just to add the kind of coverage that members typically enjoy in other states around the country. In New York, because of all the regulations, rates are simply too high. So, obviously there's a lot wrong with the plans in Congress, but what should we do? The main thing is we need to learn from history. Kentucky got burned when they tried these ideas 15 years ago, but they managed to turn things around. New York still hasn't realized how much they're hurting their citizens with their well-intentioned but short-sighted regulation. Congress should look at these examples and many more to see what has worked and what hasn't worked. Healthcare costs have risen to over 16% of our GDP. That means about $1 out of every 6 in our economy goes to pay for healthcare. Not health insurance, but healthcare. We can't keep this up, or we'll all go broke just paying to see the doctor. We have to rein in these costs. That's where insurance companies help. You know those complicated bills you get from the hospital? Have you ever looked at how much your insurance company saves you? It's a huge discount. Insurance companies negotiate discounts that most of us would never have the time or knowledge to do on our own. And insurance companies could do an even better job negotiating these rates, except for a lot of other well-intentioned but short-sighted policies on the books in states around the country. I'll address these issues in other videos. That's all for now. Check back at fixthehealthcarebill.com, or you can also find my site at theanonymousactuary.com. Keep your questions coming, and I'll do my best to provide a point of view that you may never have heard before, and more than a few things that may really surprise you. Thank you for your time watching today. It is my hope that through millions of us working to understand the issues, we'll come up with a better solution, something that really helps our country to lower our health care costs and provides access to care for millions more Americans. Thank you. Have a great day.